Do you sometimes feel fever, joint pain, or notice a sudden rash after a mosquito bite? You might have thought it was just a small bug irritation, but what if it was something more silent and serious, like Zika virus? Imagine you're on a tropical vacation, enjoying the beach, and get bitten by a tiny mosquito. A few days later, you feel tired, your eyes turn red, and you get a mild fever. Many people ignore these signs, thinking it's just a cold. But for pregnant women, this seemingly mild illness can lead to serious problems in their unborn babies, like a smaller head and brain development issues. Zika is sneaky because it often feels like a light flu, but its impact can last a lifetime. What causes Zika? It's caused by a virus spread mainly by a special mosquito called Aedes aegypti, the same one that spreads dengue. Think of this mosquito like a tiny flying syringe that picks up the virus from an infected person and injects it into the next person it bites. These mosquitoes love clean, still water, like the water in your flower pot, small bucket, or even a bottle cap left outside after rain. They also bite mostly during the day, especially in the early morning and late afternoon. But here's something surprising. You can also catch Zika from having unprotected sex with an infected person, even if they don't feel sick. So it's not just about mosquitoes, your choices matter too. Now, have you ever felt mild fever, itchy rash, red eyes, or joint pain all at once and thought, is this just allergies? Many Zika-infected people do. In fact, about 1 in 5 people with Zika show symptoms, and others don't feel anything at all. Picture this: your friend returns from a trip abroad, says I had a weird rash, and brushes it off. But then they might unknowingly pass the virus to someone else, maybe their pregnant partner, through sex or a mosquito bite. Common signs include fever, rash, joint pain, mostly in hands and feet, and conjunctivitis, red watery eyes. Symptoms usually last 2 to 7 days. But even if you feel fine, you can still spread it. Scary, right? That's why awareness is key. So, how do doctors know it's Zika? Let's say you're feeling sick after traveling to a Zika area. Your doctor might ask for a blood or urine test. These tests look for the virus or antibodies your body makes to fight it. But here's a challenge. Zika symptoms look a lot like dengue or chikungunya. So, proper diagnosis needs lab support. If you're pregnant and test positive, your doctor may do extra ultrasounds to check your baby's brain development. Unfortunately, there's no specific medicine or antibiotic that kills Zika. Treatment, think of it like fighting a cold: rest, drink fluids, avoid dehydration, and use medicines like acetaminophen for fever and pain. But avoid aspirin or ibuprofen until dengue is ruled out. They can cause bleeding. The best treatment, avoiding infection in the first place. Can we really stop Zika? Yes, but it takes teamwork. Let's play a quick game. Look around your house. Do you see any containers with standing water? That's mosquito baby food. Toss it, cover it, or turn it over. Use mosquito screens on windows, sleep under bed nets, and wear long-sleeved clothes in risky areas. Use mosquito repellents with DEET, picaridin, or oil of lemon eucalyptus. They're safe even for pregnant women when used correctly. Here's another tip. If your partner traveled to a Zika zone, use condoms or avoid sex for at least 3 months, because the virus can hide in semen. Communities can also join cleanup drives to remove mosquito breeding sites. Prevention isn't just science, it's common sense in action. Scientists are working hard. Imagine a future where a simple vaccine stops Zika before it starts. Good news, several vaccine candidates are being tested. One type uses a small, harmless piece of the virus to train your immune system, kind of like a fake drill for your body's defense team. Also, researchers are using genetically modified male mosquitoes. When released, they mate with wild females and produce offspring that die before adulthood, reducing mosquito populations naturally. In Brazil and other countries, these trials have cut local Aedes numbers by over 90%. Plus, faster, Cheaper tests are being developed so people can get diagnosed quickly, even in remote areas. The future is hopeful, but for now, staying informed and safe is our best protection.